Stroke can strike anyone at any time.
Heart diseases. Common heart disorders can increase your risk for stroke. Neurological disorders. A stroke can sometimes cause temporary or permanent disabilities, paralysis or loss of muscle movement, sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking, or difficulty understanding speech, sudden trouble seeing in one or both eyes, trouble speaking. Around 1/3 of stroke survivors have problems with speaking, reading, writing and understanding what other people say to them. Trouble seeing. After a stroke, you may have difficulty with visual processing or your ability to make sense of what you say. Dizziness. If a stroke happens in your cerebellum or brainstem, the areas that control balance in the brain, you may be left with vertigo. Severe headache. A sudden severe headache can be a sign of a stroke. Depression. Depression and anxiety are common after a stroke. You may have depression if you feel sad or down for more than 2 weeks. Anxiety. Even a slight increase in stress and anxiety levels may raise stroke risk, according to a research study published in the American Heart Association's journal Stroke. Brain disorder. Stroke is a disease that affects the arteries leading to and within the brain. Hyperactivity disorder. Studies have found that as many as 46% of children who had a stroke develop attention deficit hyperactivity disorder. Post-traumatic stress disorder. PTSD is recognized as an independent predictor of stroke and is also associated with the development of stroke risk factors. Agitation. The reason is simple. Stroke impacts the brain, and the brain controls our behavior and emotions. Delusions. A stroke can sometimes lead to hallucinations or delusions, and may happen in up to 1 in 20 people.